Dr. Brown 15 years, and I have had a problem with my left ankle, foot. Went to an orthopedist, and he didn't know what it was. He sent me to a podiatrist who wasn't sure. He thought it was plantar fasciitis. So then he gave me orthotics and new tennis shoes, and that didn't take the pressure off the leg going up. And so Dr. Brown tried dry needling, which has significantly helped to reduce the pain. And so after weeks of dry needling, I feel much improved, and I can even go down our work steps where I hadn't been able to do that for 6 months.
Okay. Dr. Brown from K&S Chiropractic, offices in Eldersburg and Owens Mills. Let me, we have been treating Jill for this problem. So when she went to her podiatrist, they diagnosed her with the plantar fasciitis, like she said. Wasn't a classic presentation of plantar fasciitis, where somebody normally has pain over the bottom of the heel, over the arch, into where the muscles insert and the tendons insert into the back of the heel and that lower part of that heel. She didn't really have that. She had a little bit of that, which we got rid of, but she's left with this stubborn pain on the medial aspect of this foot. And I'll show you what's going on with Jill's foot. Jill, stand up for a second. You can see, if you take a look at Jill's foot here, just stand normally, Jill. She overpronates tremendously. She puts a lot of pressure on the inside of this foot. That's not good. A normal person should stand, they should be balanced. Her foot's turning on like this. When you turn down and you flatten this part of the foot, you're putting a constant strain on the tendons, the ligaments, and the tissues that insert into that area. And this is where she's been having her pain. So we're gonna dry needle this. Let me show you what we're gonna do. Jill, lay on your back for me. I already marked Jill up, okay? And we clean the area. And let me show you what we're gonna do here. So she's been having this stubborn pain. What I was saying about when somebody has plantar fasciitis, normally when somebody has the plantar fasciitis, they have pain over this medial aspect of the foot, all over the arch in here, pain going into the heel, pain into the heel. She had a little bit of that. We were able to get rid of that with the dry needling, but she's still left with a lot of pain in here. So since the dry needling wasn't helping to get rid of this extra pain here, I decided to start doing some of the muscles that come up from this upper part of the leg down into this foot. So you got a couple muscles here. You got your tibialis anterior, tibialis posterior, which start on this lateral aspect. They kind of go down the front of the leg into the medial aspect of the foot. And that's what we've been dry needling. Natalie, coming around here, let me show you this, what we're gonna be doing. So we already marked Jill up and we prepared her with, wiped it down with alcohol and everything like that. What we're gonna be using is 1.5 inch needles into this area. So this is your tibialis anterior muscle. You have a lot of trigger points that form in this area that can refer pain down in here. And she's very tender over these tendons. So the dry needling, what that's gonna do is that will help to relax these areas, relax the tendons, relax the muscles. So like I was telling you before in the other videos, a lot of times we do dry needling into the trigger points of areas of spasm that form within the muscle. And that's normally where we do our dry needling into the muscle. Now, I know these are a little tender, but there is muscle here which we're going into. We're going into the trigger points there. And then down here we're gonna do the tendons. And I'll explain to you in a second on why it works going into the tendons and the fascia, because we're going to do underneath the bottom of her foot. But I'm glad that this has finally started to give her some relief. Along with the dry needling, if we can straighten this out and reduce this swelling, this inflammation, this irritation in the area with the orthotics that she got from her podiatrist, that should really help to stabilize it and balance it out. Remember, the orthotics that you get, they don't cure anything. They help to stabilize it. They're good while your foot's in there, while your foot is on the orthotic. So if we can relax all this, the tissues will relax, they'll start to heal up. Then she has this orthotic in there, that should give her some good stability. Come on around here, Nat. Now we're gonna do into this area. in this lower aspect of the ankle, lower part of the leg. This is where a lot of the tendons start to pass through this area. These tendons were very, very sensitive on Jill, all through here. And she's wincing over there because they're tender. So we're gonna needle this. Now, why does it work on a tendon? Well, the theory behind it is, let me explain to you a little bit about a tendon. A tendon is a white tissue. Our muscles heal very well. I know it's a little tender. Our muscles heal very well because there's a good blood supply. When something has a blood supply, nutrients come to the area efficiently, waste products are eliminated, there's a good exchange of fluids. These tendons and these deep structures, these white structures, a tendon's white, have a very poor blood supply. When something has a very poor blood supply, it has a very hard time healing on its own. So the purpose to ultrasound, electrical stimulation, things like that are to help an area that has a poor blood supply heal better. So the needles that we put in here, what they're gonna do is they are gonna stimulate this tendon and create a kind of like a counter irritation. We're trying to irritate them a little bit so then your body will realize that this area has been damaged, bring blood, bring different things to the area to then get it to heal better. And that's what we want. We want to create a reaction where your body will start to heal that. And I know that's tender there because I'm right on the tendon, right, Jill?
Mm-hmm, yeah.
Does it feel great?
It feels good now. It's like a warm washing
that's what we
over the
want.
leg.
That's what we want. And then we're going to do a couple right here, which I know is going to be very tender. And this is where the tendons insert right into this medial aspect of this foot, this medial cuneiform. And let's just put a couple around here and she'll be good. Hopefully she won't cry. I know it's a little tender here, Jill. And I'm right into that, right where those tendons insert, right around that joint. Feel all right, Jill?
Mm-hmm.
And we're good. So what we're gonna do is we're gonna leave these needles in here for about 10 minutes. I'll show you how we take them out, and hopefully Jill will start to feel better. Be back in a... Okay, everybody, we're back. Jill's been on there for about 10 minutes. What we're gonna do is we are gonna take the needles out. All right, here, I'll do these first. So this doesn't hurt. Needles come right out. Look, what we're hoping is gonna happen here is that as these tendons relax, as that swelling, that inflammation gets away from those tendons, it'll give the tendons a chance to heal. And then with the orthotics that her podiatrist prescribed, hopefully the foot is able to relax, the tendons are able to relax, and things will start to heal up well for Jill. We'll see what happens over the next couple weeks. Maybe we'll do another follow-up video with Jill and let you know how she's feeling. And that's that. So appreciate everybody watching. Please go to my YouTube channel and click the subscribe button. Thank you.